What do we know about contagiousness after you're vaccinated, Dr. Governman?
Well, we weren't able to know very much about that based on the initial phase 3 trials, because the phase 3 trials were designed to learn whether the vaccination prevented moderate to severe COVID. And they did that amazingly well. To actually ask whether they prevent infection, asymptomatic infection, means you have to, do PCR measurements of those subjects really frequently to be able to catch that. So that's a much more difficult trial to put together. And obviously the priority was COVID-19, right? And the symptoms of COVID-19. But we are learning that the vaccines are likely preventing transmission. There is some early data that's coming out that looks really promising. And the reason why we couldn't say anything up front was because when you think about it, you're getting the vaccine in the arm, and that was a very rational decision to do that. We know a lot about how that works when we vaccinate intramuscularly. But if you're exposed to SARS-CoV-2, you're getting it through the airways. So we really have to learn how that works. But so far, it does look like transmission of the what we call the wild type, the original parental virus, appears to be blunted by vaccination. But in reality, if you've had the vaccine, no one knows if you've been vaccinated. So you're not going to walk around saying, I'm not wearing a mask because I was vaccinated. That's worse than the selfie. So we do have to continue to make those, to perform those public health measures that we've been told to do. And because there's still a lot of unknowns. And I think one of the frustrations that when I talk to people about the immune system and vaccination is in the context of this pandemic, is that, well, we keep learning new things. Well, yeah, we've only had the virus for a year. And so we have to be able to make evidence-based decisions when the data teaches something new. And the data are going to teach us new things. If you remember at the beginning of the pandemic, there was no mask recommendation. And now we know that's brain dead. Of course you're going to wear a mask. So I just would encourage your listeners to take a big deep breath, know that people are working really hard on this, and then as soon as we learn more, we will communicate it in the best and most effective way possible. So for the moment, we should assume that we could potentially be contagious, even though we've been vaccinated and will be protected from getting COVID-19. But as data emerge, I think we're learning more that there is a positive effect on limiting transmission.